Hello, my name is Sandy Miller. In this presentation, we'll be focusing on the underserved areas of Northeast Tennessee. This area is important to me because this is where I grew up, where I currently live, and where I have raised my children. I love this region and the people who live here. I believe it is one of the most beautiful places in the world. However, along with all of this natural beauty and mountainous area comes many people who are impoverished and underserved in many ways. In this presentation, we will be talking about research and knowledge of who lives in this underserved area, why this area is underserved, and how to best practice social work for those living in the underserved area of East Tennessee. Here are some facts about Tennessee. 93% of Tennessee is considered rural, and 70 out of 95 counties had at least 50% of residents living in rural areas. Listed on this slide are the counties where I work in Northeast Tennessee. They are Unicoi County, Carter County, Washington County, Sullivan County, and Greene County. This is where I see in my job every day the ways in which this area is underserved. Here are statistics about the Northeast Tennessee poverty rates. These were found on the Upper East Tennessee Human Development Agency website, and the research is from the year 2022. The national average poverty rate, according to the U.S. Census Bureau for 2022, was 11.5%. These numbers for the areas of Northeast Tennessee are all higher than the national average for 2022. Here are some specifics about each of these counties. Each slide will have the name of the county, the percentage of people who have no health insurance, the percentage with free and reduced lunch, and the percentage of households receiving SNAP or Supplemental Nutrition Assistance Program benefits. The first slide is Carter County. Here are the results for Greene County. Here are the results for Sullivan County. And here are the results for Unicoi County, which is the county where I grew up. Here are the results for Washington County, which is the county where I currently live. Why is East Tennessee an underserved area, especially looking at things like health care? Lack of access to needed health care services and specialty care are important things to look at. One example I would like to look at is how these counties and others in Tennessee are underserved is the lack of access to needed health care, especially specialized areas of health care such as gastroenterology or neurology. This is an issue I deal with every day with the clients that I work with. Being uninsured is another way that many in this area are underserved. Lack of adequate transportation is another way that people in this region are often underserved. In my current job, I have people that I work with who travel 45 minutes to an hour for needed specialty appointments. Most areas in this region do not have public transportation. When looking at race, ethnicity, income, and location, Tennessee is one of the largest and most diverse states in the Appalachian region. 52 counties, which is over half of the counties in Tennessee, are classified as Appalachia, which is mainly rural and small towns in the eastern part of the state. These tend to be poor yet very understudied. According to the America's Health Rankings in 2021, the state ranked 44th and 45th in health outcomes and cancer deaths nationally. The article on assessing health disparities in breast cancer incidence in Tennessee discusses two dimensions of healthcare access. One is economic access. This looks at the affordability of it. The second dimension discussed is geographic access. This looks at reasonable distance travel time to providers. People may not be as likely to seek early medical care if they have to travel a long distance. The people who live in Appalachian Mountain region of Northeast Tennessee have a rich culture and history. They are strong and proud. They often rely on one another and take care of their own. Family and faith are important topics. These are a few of the strengths of these people. However, according to the article by Salmeron et al., people who live in Appalachian regions have poorer health outcomes, lower levels of literacy, and can experience higher rates of poverty than non-Appalachian regions. According to bestneighborhood.org, the majority race in Tennessee is white, which makes up 75.6% of the residents. African Americans are the next most common racial group. There are more white people in the northeast area of the state. In the article by Salmeron et al., they state that central Appalachian areas, which include northeast Tennessee, have a high burden of cancer. However, research rarely includes central Appalachia. The authors go on to say that this health disparity has many challenges, including the fact that residents of rural Appalachia are at high risk for not receiving recommended screenings, cancer screenings like mammograms, for example. Some of the contributing factors to these lack of screenings could be lack of education, unhealthy lifestyles in the Appalachian culture, geographical variations, and persistent poverty. In the article that Paul Irwin titled Poverty in America, How Public Health Practice Can Make a Difference, he discusses a memory from 15 years ago. He talks about a young girl who is outside her mobile home in a thin dress. She's living in the Appalachian Mountains. He and others with him approach her open front door. Inside the mobile home, there is a bare mattress on the floor and scattered empty cans of food. They are there for a home visit because the teenage boy who shot and killed his mom's lover. His mom was also accused of child abuse and child neglect. The author goes on to talk about how he has tried to imagine the life of this young girl since then. He thinks about how the cycle of poverty, poor health, low educational attainment, and low social status are all connected with new generations experiencing health inequities. In this region, some of this cycle is so familiar that we no longer even notice it. Irwin goes on to discuss in his article several concepts which I think can be applied to social work practice. He talks about having an initiative where people in the community make decisions about what health care needs are important. He gives the example of one community who wanted dental work. There were no dental providers in their county. I understand the importance of this as I currently work with clients who have to drive 2 hours in order to get care from a dentist who accepts their insurance, which is TennCare through the state of Tennessee. He also talks about education and the importance of allowing students to see and experience the challenges of living in poverty because these students are going to be working with these clients someday. In the preamble, the Code of Ethics for NASW, it talks about how the primary mission of social work is to enhance human well-being and help meet basic human needs of all people. And we want to pay attention to the empowerment of people who are vulnerable and oppressed and live in these underserved areas. I believe these concepts discussed by Irwin go along with this idea, Code of Ethics. In the article on barriers to healthcare and social service utilization among rural older adults who use drugs, the most common barriers to utilizing social services and healthcare were lack of transportation and fear of stigma. This study looked at 375 people who were 50 years and older. The average number of barriers was 2.53, and those who were either uninsured or homeless had 37% more barriers. The article goes on to say that the reported rate of drug overdose deaths is higher in urban areas than rural areas, but the people in rural areas face unique barriers. Some of these include insufficient access to harm reduction and treatment resources. They talk about transportation being a barrier, which we've talked about earlier. This includes having to drive long distances and lack of public transportation, and the care they receive may be substandard in relation to the care received in urban areas. This article also points out the importance of the primary care provider in rural areas. It is extremely important for social workers in these rural areas to have relationships with other professionals such as doctors so that we can work together to best serve our rural clients. 34% of respondents in this research reported being fearful of disrespect due to their drug use. This is where social workers and our NASW Code of Ethics are instrumental in working with clients. We have a commitment to promote the well-being of clients. We also look at the dignity and worth of the person and treat others with respect. This could help eliminate some of the client's fear. In the article on health disparities among employed adults with COPD living in Central Appalachian United States, the authors looked at data from people living in 4 Central Appalachian states, including Kentucky, North Carolina, West Virginia, and Tennessee. They want to talk about how COPD is inversely related to socioeconomic factors. These factors include things like education and income. Both of these can restrict access to care and treatment, especially when these patients have a low socioeconomic status. There is growing attention in looking at health disparities and health inequities associated with the disease of COPD. The authors state these are often the result of avoidable and unjust distribution of social, economic, or healthcare resources between different population groups who live with COPD. Racial and income disparities can disproportionately impact people with COPD living in this disadvantaged Appalachian area of the United States. One very restrictive barrier that adversely impacts disease management for high-risk patients with COPD is inadequate access to health care. A look at environmental justice. One other area of concern is looking at environmental injustices in these areas. In the article, Environmental Justice and Social Work, a study across practice settings in 3 U.S. states, the authors discuss how environmental issues and related injustices are becoming more apparent in social work practice. They want to discuss how low-income people and people of color are disproportionately exposed to things like pollution, toxic waste, and other forms of environmental problems. This study looked at experiences and needs of social workers when working in environmental justice issues in different practice settings. There is very little known about this area, but this article was interesting. Social workers are accustomed to promoting human rights and social justice. It just makes sense that we would be involved in responding to environmental justice issues and movements. For example, the article talks about how social workers are often first responders in disasters. The agency I work for was involved in getting needed supplies to individuals affected by the flooding of Hurricane Helene. We were able to talk with our clients who had been directly impacted, take inventory of their specific immediate needs, and gather resources to help with those needs. We delivered things like food, water, baby formula, diapers, and even wipes because they did not have running water to take showers. We set up a resource hub in our office building to help meet the needs of people in our community and the surrounding counties. As a social worker and someone who follows Jesus, I want to serve clients well. By being aware of these issues that affect our rural clients and thinking about how to best practice social work in these areas, we can meet our clients where they are and work with them. I will end with some scripture from 1 Peter chapter 4, verse 10, which says, "As each one has received a special gift, employ it in serving one another as good stewards of the manifold grace of God." I feel that social work is my gift, and I am thankful to be able to practice it in beautiful Northeast Tennessee.